headaches to chronic fatigue and facial pain, are painful sinus symptoms actually stopping your day-to-day activities? One treatment could help you get long-term relief. And here to explain, please welcome back Dr. Vincent Onrubia, founder of American Sinus Institute. Good morning.
Thank you.
All right, and by the way, I should mention your Houston location is opening
a week from Monday.
Yeah, and definitely needed, especially here in the Houston area. We have lots of things that kind of complicate people's sinuses. Okay, so sinus symptoms, they really do shut you down.
That's correct. There's so many different things that are reasons you can have a problem with your sinuses and symptoms that you may not connect.
Yeah.
Ear pressure, headaches, drainage. People sometimes don't believe or even think about those as being a sinus-related symptom.
Yeah, because people say, oh, I suffer from migraines, and they'll think that's just a whole other headache issue. Trouble sleeping, ear pain and fullness that you talked about, sore throat, bad breath, all these things that kind of all roads lead to the sinus. A lot of times people, I think, confuse it, too, with just having allergies.
That's correct. It always gets mixed up, and allergies are something you can treat with all these, as we were speaking earlier about, all these over-the-counter medications that used to be prescribed. But now you have all these drugs you can go get at the pharmacy, and you're treating the symptom with a medicine that doesn't cure the problem.
Yeah, all right. So sometimes people can get relief and then move on for another few months and stuff. Who should stop and say, maybe I don't need to be taking medication, maybe I should look further into another procedure?
If you're a person that's going chronically taking medications for your allergies, or if you're someone who has chronic headaches, you're not sure why your migraine medication, quote unquote, isn't working, that's something that could be indicative that you're not really having migraines, you're having a problem with your sinuses. So people that are chronically taking medicines, I think in general in life, the less medicine you take, the better off you are.
Yeah.
Better to do something that can effectively fix the problem, and that's what this balloon sinuplasty procedure does.
Yeah, and I would imagine, especially with the medications, you keep taking them. A lot of times they weren't designed for long-term or daily use or hourly use for some people, so you can do more harm than good. All right, so the balloon sinuplasty. Explain what that means.
What we do in our facility is we do a procedure that allows us to put small balloons in areas of the nose that enables the nose to have more space. And it gives you more room without destroying or removing any tissue out of your nose. So more room to accommodate your allergies, swelling, etc. That provides better ventilation. You can sleep better. The pressure in the sinus is equal to the pressure in space. That eliminates the headaches, and is done in a minimally invasive way with anesthesia.
Okay, so the balloon goes in. It doesn't stay there, does it? It just kind of...
It goes in, it expands. It then enables us to rinse the sinus out, and once the sinus is open and clean, we move to the next sinus. There's 8 sinuses in your head. Sometimes all are involved, sometimes just a few of them are involved. And we're using a special device that we used that's developed by Johnson & Johnson that I believe is the best balloon on the market that enables us to open the sinus and rinse the sinus effectively and painlessly.
Yeah, and this is good for adults and children?
We've had patients as young as 8 and patients as young as 93 that have done this procedure in our clinics.
Wow. And when you open up the sinuses like that, because I would think that another problem is recurrent infections, because when it's basically an incubator for bacteria if you don't have the open, clear pathway.
That's correct. And that's why it's really critical to go to someone that uses the procedure or does the procedure and rinses your sinuses, not just opens them, but rinses and cleans them out as well.
Yeah. All right. Anytime you talk about doing a procedure, it's amazing to me how many times people can be suffering and go, but wait, is it going to hurt? But wait, what's going to happen here? And we say minimally invasive. That's the best thing.
And minimally invasive is because of the technique we developed called the Onrubia technique, but also we will be, I believe, one of the few facilities in Houston that's using general anesthesia to do the procedure. So you don't have any type of pain, recollection of the procedure, and it's a procedure you can get done and be back to work the same day.
Yeah. How long does this last?
This is a permanent solution for patients because it reshapes the bony structures that open the sinuses. So this is not just a soft little balloon that opens up the soft part of your nose. It's a balloon that opens up and reshapes the bony canals that open the sinus cavities. Yeah. A permanent fix, a permanent opening of the sinuses.
Many patients have suffered for many, many years. So what do they say to you if they come back for that follow-up visit? What do they say in terms of how this has literally changed their life?
Even back to this issue with smell. You have patients come back, even when they come back a week later, say, I haven't smelled, I haven't been able to eat food, I haven't been able to cook.
Yeah, because if you can't smell, taste is even impacted.
Exactly. So people end up with increased smell, increased taste. A lot of people haven't slept flat. A lot of people are sleeping upright. A lot of people in Houston are sleeping in chairs because they can't lay flat. I have had patients wake up from the procedure and doc, lay me flat, lay me flat. Big 200-pound men. You lay the guy flat, he starts crying because he hasn't laid
Wow.
flat for 20 years and been able to breathe through his nose.
Yeah, yeah. And I have a friend who, with her issue, she said, I could never count on anything. If there was a wedding I was going to, I wasn't sure I was going to make it. You know, whatever, her kid's school play, wasn't sure she was going to make it. And this is one of those things that can just wipe that part out of your life.
That's correct. In a 15-minute in-office procedure, we can get you breathing normally, eliminate your sinus problems, and allow you to accommodate for allergy, perfume, smoke, without having symptoms.
All right. Well, thank you very much. For more information on the Onrubia technique at American Sinus Institute, you can call a very simple number here, 713-BALLOON, 713-BALLOON. That works out to be 713-225-5666, 713-225-5666, or log on to AmericanSinus.com. They have multiple locations. We mentioned that the one in Houston is opening next week, but you have them in McAllen and San Antonio as well. State-of-the-art facilities with this particular technique that is less invasive, 15 minutes in the office, and there you go. Thank
Yes.
you. Well, flu season is here. We'll